Okay, today we're going to talk about PPE. We're going to put them on, take them off. Now the main reason we want to have PPE is so that we can not get infections and not pass infections to patients, or patients on pass infections to us that can spread through the hospital or any acute care facility. Because there's three elements. You have your source of infection, you have to find a susceptible host, and there's a pathway from the source to the host. So by donning your PPE, you hopefully are taking away that pathway from the source to the host. Typically, you're going to want to go big to small. So first I'm going to shake out my gown here, and I'm going to go in on the inside. You want to make sure that your thumbs go all the way in so that it's secure, and you want to make sure that it comes around mid-thigh. And then on the side are my ties, and you want to tie it in the back. That way it doesn't dangle over a patient. That way it can't contact a patient and get dirty. So that's important. Unfortunately, I'm not really good at tying, so just give me a second to see if I can tie this. There we go. And then next, I'm going to go on the inside and bring overhead. As you can see, over mid-thigh, thumbs are covered. Great thing about this is it's almost like a shotgun approach. It covers a ton of body area, so if a patient's coughing, if they have to throw up, hopefully this will cover a lot of that. Next, I'm going to go with the mask. Now, you're going to normally use this for droplet precautions, but it's probably good to use this as much as possible. And so you're just going to take the ear things, put them around the ear so it's secure. There's a metal bar. I want to make sure that that is snug around my nose and around the rim of my face to make sure that nothing can get in. And then here I'm going to bring this under the chin to make sure that's secure and nothing's getting in that way. So as you can see, I'm covered in all areas, and that's going to help cover droplets so nothing gets in my mouth. Nothing from my mouth can get into someone else's, no saliva or anything like that. Next, if I had them, I would put on the goggles. Goggles and gown are used a lot of times for contact. So if I have the goggles on, touching my eye, nothing can get in there, I would put those on. We don't have those today. Next, gloves. One thing with gloves is you want to make sure there's not a latex allergy. If there is, you probably want to get a different type of glove. So you want to just make sure that your patients are okay with having latex, and you want to make sure that it covers the entire gown so that you're kind of cutting off any pathway that a susceptible host can get into. And of course, make sure that they fit your hand nice and snug. Of course, I have little hands, so these are like the tiniest gloves you can get. Just don't tell that to my girlfriend, please. She might be disappointed. So then I will go gloves. And there you go. We are good to go on the gloves. It is covering everything. Actually, let me just get under here a little bit better. That's better right there. So then when we're going off, we're going to usually go small to big. So the first thing I'm doing is the glove. And the thing I really want to think about is the clean part of what I'm wearing versus the contaminated part of what I'm wearing. So I always want to touch the clean part. So I'm going on the inside of the glove. And since I turned it inside out, this side's clean, and I can use that to get inside my other glove, turn that inside out, and disregard. Next, if I had them, I would take my goggles off, and then next I would take my gown off, and to do this, I kind of just shimmy my arms here. There, and then I can untie through the clean side, coming up, clean side, off of my head, disregard, finally, clean part on the inside, not touching the outside of the mask, taking off. One thing I wanted to talk about before closing out with the video is you always want to put your PPE on before you enter the room, that way that you're contaminant-free, entering a contaminated environment, and then you want to take it off before you leave the room. That means that I want to take it all off before I go to a clean environment, because this is obviously contaminated now. Thank you.